Chikungunya? Chikungunya is a viral disease transmitted to humans through the bites of mosquitoes infected with the chikungunya virus. The word chikungunya comes from Tanzanian Makonde dialect, which means disease that bends up the joints, referring to the posture of patients who suffer severe joint pain due to this infection. How is it transmitted? Chikungunya is a mosquito-borne viral disease caused by a virus from the genus Alphavirus in the Togaviridae family. Chikungunya is not transmitted from one person to another. The virus needs a vector, which is mosquito. It is transmitted by the bite of the Aedes aegypti and Aedes albopictus mosquitoes. It was first reported during an outbreak in southern Tanzania in 1952 and has now been identified in nearly 40 countries in Africa, Asia, Europe, and most recently the Americas in the Caribbean island of Saint Martin Island.
Once upon a time, there lived a family. The husband and the wife are so busy working day and night until they have no time to spend together at home. Their daughter does not like to tidy up the house, especially the outside. However, one day the girls felt sick.
It hurts.
Zulaikha, who had just come back from work, came in to check up on her daughter whose fever did not subside.
Get up and get dressed. We're going to the hospital now. Let's go.
What symptoms do you have?
I have been down with a fever for 5 days and my joints feel so weak.
Dr. Aishah ran several tests and took blood sample from the girl. After running the test,
I am sorry to inform that your daughter have been infected with chikungunya virus.
Chikungunya? How is that possible? What are the symptoms?
Chikungunya is caused by bites from mosquitoes that have been infected with the chikungunya virus, like Aedes aegypti and Aedes albopictus. Usually, the symptoms will show about 4 to 8 days after being bitten, but it can also occur from 2 to 12 days after being bitten by the infected mosquito.
Aedes aegypti is a small mosquito that has black and white stripes on its body, but can be distinguished by white stripe with a layer shape on the thorax. While sucking blood, this mosquito prefers mammalian hosts. Aedes albopictus is also a small mosquito with black and white stripes on its body, but can be distinguished by the straight stripe in the middle of the thorax. Overwintering is a special feature of this mosquito. Unlike Aedes aegypti, these mosquitoes suck blood from human, domestic and wild animals, reptiles, birds and amphibians. How mosquitoes spread disease? Mosquitoes pick up viruses by biting infected people. When they bite again, they can transmit the virus to the next person. This is how mosquito-borne disease spread. Mosquitoes do not naturally carry viruses. They can only get them from infected people. Since only female mosquitoes bite humans, only female mosquitoes can transmit viruses. Symptoms. One of the symptoms is abrupt fever that frequently accompanied with joint pain. Joint pain can be relieved in a few days but sometimes may last for months or even years. Other symptoms are joint swelling, rash, headache, nausea, and fatigue. Myocarditis, hepatitis, ocular and neurological disorders might be involved in severe symptoms. However, the disease is considered a non-fatal illness.
Is it dangerous?
It is not too dangerous up to the point of causing death. Your daughter can be cured. I would like to stress that this virus can only infect humans only once in their lifetime. because our body will produce antibody to combat the virus if it ever strikes again. Therefore, no vaccine is needed to treat it. I will give your daughter some paracetamol to relieve the fever, as well as anti-inflammatory drugs and fluids. I suggest she drinks plenty of water, about 2 to 3 liters a day.
What should we do, doctor?
Well, I suggest you protect yourself from mosquito bites. The most important step is to make sure that your house and the environment is clean. As you know, mosquitoes lay their eggs in water. Therefore, you must check for containers that hold water every week. You have to empty, scrub, cover or throw out items that hold water like old tires, buckets, flower pots or pools. When you are out of the house, I suggest you apply insect repellent to avoid mosquito bites. Wearing long-sleeved pants and shirts are also recommended, but make sure you wear bright colors because this insect is prone to dark colors, especially black. You can also install a mosquito net over your bed in order to get a better sleep.
Alright, thank you, doctor.
Few days later,
Good afternoon, sir. We are from the Ministry of Health, KKM, would like to do an inspection of your house. We found out that many residents in this housing area got infected with Chikungunya virus lately.
good afternoon. Please come in.
Sir, please make sure there is no stained water in the plate of this flower pot because this is where the mosquito breed.
Alright, miss.
We suggest the resident clean up this neighborhood after we carry out the fogging process. There are just too many areas that have potential to become breeding ground for the mosquitoes. Later, we will inform the head of this neighborhood.
I agree, but aside from the flower pot plate, where do mosquitoes often breed?
Usually, items or places that hold water like pools, polythene container, tires, trash container, and so on.
Okay, thank you for the information.
We will do fogging process tomorrow. I hope your family is informed about this.
In the nutshell, if any premise gets caught as a place of mosquito breeding, a maximum compound is Rm500 ringgit could be given. Court will take an action on the repetition mistakes by fining them up to 10,000 ringgit in maximum, or jailing the owner for not exceeding 2 years, or both. It was stated in Akta Pemusnahan Serangga Pembawa 1975.